Welcome to Curano Med. This will be a series of teaching about the basic laparoscopic surgery skills, and the first lecture will be based on the introduction and the basic principle of laparoscopic surgery. I'm David Lomanto. I'm an associate professor at the Department of Surgery of the National University Hospital, and I work with Curano as a consulting to develop this program and this basic skill laparoscopic surgery educational program. The basic terminology of laparoscopy comes from the Latin. The words lapar means abdomen and scope means looking through using an instrument. So the generic word of basic laparoscopic surgery involves mostly the abdomen, even though we always talk about laparoscopic when we access any cavity, any space within the human body. The history was coming from the long past in terms of Hippocrates. When in Greece, he was the one who developed the first rectal speculum. So looking through a cavity like the rectum was something that started even before Christ. But subsequently, early 1900, when the laparoscopic itself took a very important roles with two pioneers like George Kelling and Jacobeus, and they used to treat the TB, the tuberculosis that at the time was really a plague for the worldwide community. Subsequently, another surgeon, Janos Veres in Hungary, developed the Veres needle, a spring-loaded needle that allowed the gas and to insufflate using any kind of gas. Today we use carbon dioxide, but in the past they used natural air to insufflate it to make a virtual cavity a real one. Later on in the 50s was Harold Hopkins. Harold Hopkins that was important for two inventions. One is the famous rod lens, and the one is the fiber optic endoscopy. This is also involved other surgical specialty or medical specialty like a flexible endoscopy, because the rod lens have the peculiarity to magnify the image that we see through the endoscope. Subsequently, in the 60s, Kurt Semp, that was also the first surgeon who do laparoscopic appendectomy, invented the automatic insufflator. So a system that allows to insufflate using a small capacity of gas to introduce it through the abdomen or through the chest. In 82, which almost when laparoscopic surgery was introduced in the general surgery world, we start to do a video laparoscopy. Of course, this all come along with the developing of new technology, the new imaging, and a new camera system that allow to attach to the rigid endoscope a camera system that allow to move the picture from the end piece to the eyepiece to the monitor. In 1987, the three musketeers, and one was Philippe Mouret, I think performed the first laparoscopic cholecystectomy. The other two, Jacques Perissat and Philippe Mouret, were subsequently, in a distance of few weeks, performing the same procedure that started a new era of minimally invasive or minimal access surgery in general surgery world. Since then, and we're talking about since 1987-88, many procedures has been done, and in many areas, laparoscopic surgery has achieved to become the gold standard in removing the gallstone or in removing the adrenal gland for any kind of benign disease or malignant disease, gastroesophageal reflux, or upper GI so-called surgery that involve also achalasia or removal of spleen for ITP or other disease, and also not only the abdominal cavity but also the chest with the development of video-assisted thoracoscopic surgery, in which bullectomy or lobectomy play to their big roles. Early in the 2000s, when surgery start to involve also the obesity, it means that when surgery starts, the obesity starts to spread all around the world. There was a need for surgery. I think laparoscopic surgery really changed the way we treat this kind of morbid the obesity disease, because initially he was affected by a lot of complications like ventral hernia or recurrence or adhesiolysis, because the way to do was using a conventional open surgery approach, minimizing the access, minimize the scar, allow more patients to benefit of the advantages of laparoscopic surgery. And today many clinical studies that involve all the diseases that we listed before and more have shown that laparoscopic surgery have less pain, have faster recovery, have a very short hospital stay, and of course much better cosmetic results when we talk about the comparison with the open surgery. You can see in the left slice here a huge scar for a simple procedure like is done today through a too small incision of few millimeters when we treat the sweaty palm or the hyperhidrosis using a thoracoscopic or today a video-assisted thoracoscopic surgery approach. So why laparoscopic surgery has become so popular, not only among the patient but also among the surgeon? Because it's the one of the fast-growing area. It follows the technology, so any advantage of developing technology today that is either imaging or either energy or either robotic, it will involve a further growing of laparoscopic surgery. So a combination of technology with patient care allow today minimally invasive surgeon to do more with less, and the use of technology has become a very important role. And the main benefit, we can say that laparoscopic surgery removes the ends of the surgeon out of the abdomen of the patient. You can see this is a big laparotomy in the past. Today everything can be done between 5 and 12 millimeter scar or even smaller. Thank you very much. This is the first part of the introduction of the basic laparoscopic surgery skill.